Good afternoon, one and all. Welcome to a very special webinar session exclusively for students, teachers, and lecturers, brought to you by SDM College, Department of Information Science and Engineering, in association with Project Step 1. I am Shruti Bharadwaj, your host and a proud volunteer at Project Step 1. Today's topic is COVID. What do we know till now and the way ahead? I welcome our very special speakers for the evening, Dr. Shamik Ghosh, who is the president of New Kolkata Academy of Pediatricians. He's also a secretary of Adolescent Chapter of New Kolkata Academy of Pediatricians, executive board member of West Bengal Academy of Pediatrics. We have Dr. Poonam Bhatia, who is the executive board member of AHA, Central Zone 2018 to 2020. She is also an executive board member of Webmaster AHA 2019. We have our very own Dr. Piyali Bhattacharya, who is here for the fourth time on the Step 1 panel. We love to have you here, ma'am. So she is a consultant pediatrician at Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. She's a member of IAP Guidelines for Committee for School Reopening. A small introduction on Project Step 1. Project Step 1 is a 100% volunteer-run free telemedicine services. We are a 7-month-old initiative that provides free telemedicine to COVID-19 impacted citizens across 16 states in India's 18 languages. We have touched more than 50 million lives through 1 million teleconsultations. This has been possible because of our community of citizen volunteers, doctors, and of course, our counselors. Dear doctors and citizens, your 1 hour per day can save thousands of lives. Project Step 1 is an impactful citizen and doctor-driven initiative, and it needs to spread wider to be able to get COVID under control in India. Dear doctors watching this session, request you to give us a missed call on 0804719219 to join the largest doctor volunteer group. Dear citizens watching this webinar, please give us a missed call on 080619722266 to volunteer. Thank you so much for listening to me. So today's session is all about COVID, and COVID. We've been listening this from the past 8 months. And what do we know till now? And what is the way ahead, especially for the lecturers and students who are waiting for colleges and schools to reopen? I would like to hand it over to Dr. Shamik Ghosh to take it over and please talk about the situation that I just mentioned. Thank you.
A very, very good afternoon to everyone who's found the time to log in and give us a very patient hearing. We are here today to be answering mostly questions which you very educated and bright young minds would be having. The entire session today shall be comprising of 3 parts. Dr. Piyali Bhattacharya, who's our senior most member here, shall be taking you through what really is COVID-19, and we should try to keep the terminology as simple and as well understood as possible. Dr. Poonam Bhatia would be enlightening us as to what are the treatment options that are available and the medical, the mental health and the physical health issues. And eventually I would be taking over to guide you to where could we be looking forward to from here on. So over to Dr. Piyali Bhattacharya for beginning the proceedings.
Shamik?
Yes.
I'll be starting the proceedings.
Okay, fine. Okay, that's fine.
We have interchanged actually.
Yeah, that's fine. That's all right.
We have just interchanged.
Yeah.
Piyali, first slide to be shown. So during the initial outbreak, thank you very much, Shruti and Step 1 for giving us this wonderful opportunity to share what the scientific facts about coronavirus, that is COVID-19. So we all know that, the first slide, that during initial outbreak, many people who suffered from this COVID disease, they visited Hunan Seafood Wholesale Market which is situated in Wuhan, state of China. In January 2020, WHO declared this disease as public health emergency of international concern. Then in February, somewhere in middle of the February, WHO declared the disease caused by coronavirus to SARS as the disease. The disease is named as COVID-19 disease. And in the March, WHO declared it to be a pandemic. That is, it has a vast coverage across globe. Now, the SARS-CoV virus, this virus belongs to a very large family of virus, which is basically named as coronavirus, and other members of this virus family, they usually cause upper respiratory infection, cough and cold, and they were prevalent since long with us. But the dreaded disease, which this COVID-19, the disease which is named as COVID-19, is caused by coronavirus 2. And this is called SARS because it causes severe acute respiratory distress syndrome. And virus usually has lot many spikes, which we all of us know, and it enters into the epithelium of nasal mucosa or oral mucosa through these spike projections. Next slide. So present day scenario is almost 69.5 million cases are across the world, 1.5 million deaths across the world, but definitely 48 million people, they have recovered from the disease, which shows that the disease has 81% of patients, they have a mild disease. Now the status of India, India has largest number of confirmed cases in Asia and second highest number of confirmed cases in world after United States. At present, India is conducting highest number of daily tests in the world. But the cases, we have already attained peak somewhere in the September with more than 90,000 cases every day to less than 40,000 cases per day in December. Now let us see how it spreads. So this disease, it spreads from person to person through coughing, sneezing, talking, breathing, singing, etc. And it spreads through three forms, like through droplets, through aerosol, and through contact. The droplet is generated when the person coughs or sneezes and other person is standing somewhere near that person. And those droplets which are exhaled out of the person, infected person, the other person gets it directly from that person. The aerosol is the solid particle or liquid droplet which is suspended in the air. And lastly, through contact, that is when a person coughs or sneezes, some droplets, they are left over the surfaces. And touching those surfaces, the person gets infected through SARS-CoV virus. The virus lives on the metal surface for at least 12 hours. That is why it is advisable to wash your hands frequently. Once you open the door or you handle some metal surface, you have to wash your hands frequently. Virus can survive on fabric for 6 to 12 hours, but the good news is that it gets washed out with normal laundry soap. So they say that washing hands frequently, because virus lives on your hand just for 5 to 10 minutes, but many things can happen during those 5 to 10 minutes also, because people, they have a habit of rubbing their nose, brushing their eyes. So that is why it is advised not to touch your mouth, your nose, or your eyes frequently, even after washing your hands. Now, the common symptoms are fever, cough, and shortness of breath. These are the most commonest symptoms. While other symptoms like sore throat, stuffy or runny nose, body ache, headache, feeling of chills, fatigue, and gastrointestinal symptoms like diarrhea, nausea, loss of smell and taste, these are the other symptoms which can be present apart from fever, cough, shortness of breath. And most important thing to be noted is that these symptoms, they can appear anywhere between 2 days to 14 days. Pyali, can you just switch out? Yes. Between 2 days to 14 days after exposure. So we have to know that even during asymptomatic phase, like on the 3rd day or 4th day of carrying the disease, The person can be asymptomatic, but he can still transmit the disease. That is the threat of this disease. Then, according to the severity of disease, it has been divided into mild, severe, or critical cases. So mild cases, like we have already seen, almost 81% of patients, they have mild disease, while those rest of them can have severe disease or critical disease. So those with severe symptoms, they'll have shortness of breath, which is because of increased frequency of respiration, oxygen saturation, which we measure with SpO2 through pulse oximeter, that is 93%. It should not be less than 94% actually. Normally, the healthy adult, the person has SpO2 of the range 97 to 100%. And lung infiltrates, like infection travels inside the lung, which is detected through CT scan, that can be more than 50%. So all these symptoms, they'll develop within 24 to 48 hours. If the person gets infected and if the person gets all these symptoms like shortness of breath, increased respiratory frequency, decreased SpO2, and evidence of lung infiltrate within 24 to 48 hours, then this is a patient comes under severe category. And then the critical cases who need ICU care, that is those patients who enter into respiratory failure, shock, or multiple organ failure. So this disease can cause a wide range of symptoms from mild to severe symptoms. Next slide, Pyali. So what is the threat? Like I said, the incubation period or the time period when the symptoms develop is from 2 to 14 days. Like I had already discussed, like on 4th day, if the person is carrying a disease and he's not having symptom, he can transmit the disease unknowingly to the other person. And if both the persons, like this person who is the sufferer or the person or the healthy adult, if both of them are using mask, then the chances of spreading disease is low. That is why it is repeatedly said, do gaz duri or mask hai zaruri. Now let us see what is RO number. This is the reproduction number. This slide shows a person who is having a disease of RO2. So this person will spread disease to 2 persons. These 2 persons will spread disease to 4. And all of you are students of mathematics, and you know how the disease is rising exponentially. And the longer incubation period and mild symptoms, they prove to be more threatening. Pyali, next. So what is the threat? Like many people, they are worried about falling ill or dying quickly. They are fearful for becoming infected at the healthcare facility. Even if they are suffering from some disease, they'll not visit healthcare facility because they think that going to a hospital or to a clinic, they'll catch the disease, which is absolutely a myth, because most of the clinics, even I would say 100% of clinics and hospital facilities, they use many precautions not to transmit any disease from their center. Then people are fearful of losing livelihood. We have already seen that many people, they have lost their livelihood. Fear of being socially excluded because of going into the quarantine, feeling powerless in protecting their loved ones. When someone gets admitted in the hospital, they are not allowed to visit their near or dear ones. They feel helpless, boredom, loneliness, and these are all, they have caused depression and other mental illnesses. And fear of being blamed for spreading the disease. That is also a threat. And all these threats, they increase the stress level, and it makes a person prone to many mental and psychological problems. Now, what are the other impacts of COVID-19? Like we have already, all of us have seen there's massive social and economic disruption, and this is the largest recession which all of us have witnessed. Postponement or cancellation of major events like wedding, and many such events. Widespread supply shortage which led to panic buying by everybody. People kept on buying lot many things and kept on storing it. Agriculture disruption and food shortages. Educational institute have partially or permanently been closed, and incidents of xenophobia or discrimination against Chinese people, that has also been on rise. So these are all the impact of COVID. But as always कि उम्मीद की किरण तो हर समय ही होती है. There's always silver lining. In similarly, we have so many silver lining in the COVID cloud. Like many people, they have rejuvenated themselves by reviving their hobbies or their old interests. People have started connecting with their old friends also. Some people, they got time, they got chance to live in the same and in the same close enclosure with their near and dear ones. And many people, they have started working on their self only. They have started regularizing their exercise routine, and I'd already discussed that reviving their old hobbies and courses also, and learning to work with the new generation that has also started. That's all. And so the silver lining in the COVID cloud are decrease in pollution. We have already seen, everybody has witnessed how clearer the environment is. They have said that because of closure or shutdown of factories, the water pollution, it has decreased drastically, and a boost of tech-based big business we have witnessed, and we are part of it also. I would just like a small support from all youngsters. So the WHO has declared this infodemic as similar to something like COVID virus epidemic. They say that everyone should learn to flatten this curve of infodemic, because fake news, misconception, they travel very quickly and very fastly. So and they generate lot of panic and confusion among common citizens. So let's be a responsible citizen and learn to flatten this infodemic curve. Really, next slide. This is the last slide. So whenever you receive any information, first assess the source. Read in detail. So go beyond headlines and learn what it exactly wants to say. Then identify the author. Don't just keep on forwarding. Identify the author. Check the date, whether it is recent or it has been spreading throughout since long. Then examine the supporting system. Search to other search engines also. And then check your biases, whether you are biased with this information, you really want to forward it, or you want to just withhold it so that it doesn't passes on. And turn to fast checkers also. So every youth must follow all these steps before forwarding any information related to pandemic. Thank you. Thank you so much. Over to Pyali.
Thank you, Poonam. So now comes the management part, boys and girls. So I have tried to simplify it, and as far as not use medical jargon, I hope you all understand how it goes. So what to do to keep yourself and others safe from COVID? So do not be selfish. Remember that you should be safe, and those who are near you should also be safe. So maintain at least 1 meter of distance between you and others. Not only that, wear a mask. As Poonam has been saying, do gaz ki duri, mask hai zaruri. So make it wearing a normal part of you when people are around. You must also know the appropriate use, the storage, the cleaning, the disposal of these masks should be effectively done. As Poonam was saying already, there are some high-touch surfaces which need to be disinfected specifically. So what are these? These are doors and window handles, kitchen and food preparation areas and countertops, bathroom surfaces, toilets and taps, touch screens. It's been seen that the mobiles have been a good source of infection spread. So one advice, never give your mobile to others to handle in this COVID era. Personal computer keyboards, work surfaces, this all must be wiped clean with disinfectants as a priority. Now, wearing your mask. So remember, your hands must be cleaned before you wear your mask, as well as before and after you take it off. And again, if you touch it at any point of time. Make sure it covers both your nose, mouth, and chin. Remember, students, that you breathe in through your nose. So when you're breathing in, if your nose is not covered, it is dangerous for your personal health because you will breathe in the germs. However, when you're breathing out germs if you are harboring them. So you are dangerous for others. So do not be selfish either to your own self or to others. Cover both your mouth and your nose. And when you're taking your mask off, storing it in a clean plastic bag or a paper bag, remember, if it is a fabric mask, you can wash it. Or if it is a medical mask, you must put it into a covered bin. Do not leave it lying on the roads, because then they will be a potential source of infection. And again, we will talk a little on masks. Do not use masks with valves, because if you are asymptomatic and you are harboring the disease, you will be breathing out germ-filled breath through the ventilation ports. So you are a potential danger to everybody. Remember that the masks create a physical barrier between the mouth and the nose of the wearer. If worn properly, a surgical mask is meant to help block large particle droplets. Similarly, a cloth mask is meant to block just large particles, splashes, sprays, or a splatter of germs coming from reaching your mouth and your nose. However, talking about N95 respirators, remember, they have very close facial fit and they're very efficient in filtration of airborne particles. Now, N95s, actually, the government does not recommend that the common person use N95 because they are scarce, and the health workers who are the corona warriors are really in need of these N95s to protect themselves. So for CDC says that for the common person, you wear a cloth mask, but for a healthcare worker, please wear an N95 mask. Now, these, as I said, there are different forms and makes. So for the students, it is recommended that they use and clean their cloth mask daily with soap and water. Avoid the 3 C's, that is closed, crowded, and close contacts. Closed spaces, crowded spaces, and close contacts. Remember, India, you see, everywhere there is crowding. I just depicted how people travel on the trains, how they are in the public areas. So overcrowding is rampant. So please avoid going to such settings. And when an indoor setting and you have little more people in the room, remember to open the window and wear a mask always. If possible, meet people outside. Even as doctors, we are conducting OPDs outside under the trees these days with chairs and seeing patients outside in the open environment to avoid droplet contamination in the room. Don't forget the basic hygiene. As Poonam was saying, wash your hands. So, and the important part is, if you have touched surfaces, which we often do, remember Do not touch your eyes, your nose, or your mouth, because they are the potential source of absorbing germs. So even your eyes, do not scratch your eyelids, do not take your hands near your nose or your mouth. So if you have to do that, wash your hands again. So frequent hand washing and frequent alcohol-based rub is important. Alcohol-based rub, again, we will talk about that. Cover your mouth and nose when you bend into your bent elbows. So how do we rhyme it? All of you must have learned your nursery rhymes. Cough and sneeze, elbow please. So that's how it goes. Cough and sneeze, you must do it in your elbow or in a tissue, which should be placed in a covered trash bin. Now, remember, regularly clean your door handles, faucets, and your phone screens so that you do not transmit the germs to others or harbor them for yourself. So, like there are 6 steps of hand washing as per WHO. If you go to your Google and search for steps of hand washing, you will of course get them. And so you wet your hands and lather them properly, and then the back, the front, the webs of the hand, the fingertips, the thumb, all of them are washed properly and finally rinsed in running water, and then your hands are dried in a clean towel or a tissue. So if you are unwell, supposing, God forgiving, you have contracted the disease, or maybe you have some symptoms. See what I have put up. The placard says, stay home. So that's the message I want to conduct to all of the boys and girls. So you should know the signs and symptoms. Dr. Poonam has already detailed all the signs and symptoms. Stay home and self-isolate first and foremost if you have cough, headache, mild fever until you recover. Call your healthcare provider or take an information on a WhatsApp call, describe what you have, and take the required medication prescribed to you. Ask somebody, like we had friends who suffered from COVID. So what they used to do is put a stool outside their room so that anybody could bring them supplies and put it outside, and they would just take it in. Even food, daily food was provided that way. So you do not need to leave the house. Stay home, but if you have to, remember, wear your mask and make it as quick as possible to avoid infecting others. And if you have, in addition to fever and cough, it is not going and you're getting a breathing difficulty also, seek medical attention immediately. Keep up to date with the latest information from trusted sources. As Poonam has been saying, learn media literacy. Go to the WHO site or to the Family Health and Welfare site. They will be providing you all data regarding and truthful data regarding. Don't go for WhatsApp newses. So difference in isolation and quarantine. A lot of people, even doctors, initially failed to understand what was isolation and what was quarantine. Remember, quarantine people are not ill but have been exposed to the virus. Whereas isolation people are positive for the virus but can stay at home because the disease is mild. Both conditions you need to separate and restrict your movement or activities from other persons. But for isolation, those people who are COVID positive, they are under healthcare supervision all the time. There are specifications for them also from the Ministry of Health and Welfare. You will find it on the site. So many people, like Vandana was saying, her son was asthmatic, and there are many people who are diabetic, many people who have been taking medication for tuberculosis. Many of them have come and asked us, should we stop our medication? And we've said, no, adhere to your treatment, your previous treatment, whatever you have been taking. So the message goes that do not stop your medication for any chronic illness that you have. If you have any suspicion about anything, do talk to your healthcare workers. As Poonam was saying again, many a times the children are coming to us and saying, feeling a lot of anxiety, auntie, what to do? So remember, draw on skills and strategies that you've used in the past that has helped you. These are life challenges, and you need to meet these lives with life skills. So what you can do is you can at least ventilate your thoughts to someone else, talk to your mother or to your father or to your friend, call up and talk and tell them how you're feeling. That helps. Express your thoughts. Many children have made art, like they have linked their emotions to the art that they have created. So creativity is one answer: writing a poem, drawing, or even maybe step dancing, that is exercise plus dancing, recreation. So there are many ways, or learning a hobby, as Poonam was saying, trying some meditation or breathing exercises, and do something active every day. Doing activity releases the happy hormones, so they will keep you alert and happy throughout the day. And remember, do not become the Devdas of Paro and start smoking out of anxiety or taking alcohol. Hum to ji bahut anxious hai. They are not helpful. In fact, they will degrade the status. So stay connected, follow the daily routine, keep your daily hygiene. At times, you may even write a diary, which helps to ventilate your thoughts. The medications that have come in, remember, the optimal supportive care includes only oxygen. If the disease is as severe as we have classified earlier, we need to ventilate who are critically ill only. And then one drug which has become the wonder drug, surprisingly, is dexamethasone, or the steroid, which has now the potential to save lives. And WHO's solidarity trial now says that the other drugs which were used have very little or no effect on a 28-day mortality or on the in-hospital course of COVID-19 amongst hospitalized patients. हाइड्रोक्सीक्लोरोक्विन, which was बंटवारा हो रहा था उसका, मतलब बिल्कुल जैसे लैया चने की तरह, that has offered no benefit on treatment of COVID-19 patients. So WHO says do not self-medicate with any medicine, including antibiotics. COVID being a viral disease, antibiotics do not act. So please don't take antibiotics for COVID as a prevention or as a cure at all. So remember, talk to your healthcare workers, and COVID-19 does not stop on its own. So breaking the chance of transmission is by appropriate behavior. 2 गज की दूरी, mask है जरूरी. Thank you so much. I will pass on the baton to Dr. Shomik Ghosh.
Very, very good evening to everyone. I'm sure by now, most of you have understood what the disease is and what are the likely presentations. And yet with this all-pervading pandemic, I mean, it really makes us, look forward to कब हमारी जिंदगी फिर से नॉर्मल होंगी, कब हम अपने अपने कॉलेजेस वापस जाएंगे, कब हम एकदम नॉर्मल तरीके से we will be able to interact with our friends, with our family. So, which brings us to the question is that the global scenario being whatever Dr. Poonam had depicted, where are we in India? Is the problem declining? You must have heard the word second wave from newspapers, from news channels. So is there a chance that though we were doing well, this might be coming back with the onset of winter? Because if you remember, everything has started sometime in end December last year. So we are in the first week of December, going on to the second week. So is there a chance that there would be a recurrence? So these are just today's statistics as far as India is concerned, and we have about 97 lakh cases, 3.7 lakhs, that is about 3.81% are active. The good thing is 94.74% have recovered, and we've had a mortality of just about 1.45%. Now, the important point that I really, Piali, if you can please keep the previous slide. Yeah. The important point that I would want to make over here, dear students, is that, statistics in their own place creates an optimism or a pessimism depending upon how you interpret the numbers. But what is important to me as an individual is that what if I were to get infected? What if a family member gets infected? What if I lose a family member or a friend? So that is what is the question which haunts most of us, because WHO has declared this to be a pandemic. People might question me, you're just having a 1.45% mortality in India. Then why is it a pandemic? Why is there so much of hue and cry about the whole thing? So the whole point looking forward is that we have to devise methods, we have to devise ways and means so that all our near and dear ones, including ourselves, we don't enter into this 1.45% bracket. Next slide, please. Uh, right. So while we are looking forward to opening up, which means trying to get back to a modicum of normalcy, what is the need for that? Pehle, the first few days when, you of the lockdown, try and remember that. I think so most people were actually quite happy, people who were absolutely ruffled by their own, stresses of their work, daily going to office, or ourselves going to hospitals, having a huge work schedule, all the corporate pressure. Suddenly there was a breath of fresh air. Hey, tomorrow morning I don't have to wake up, I don't have to be rushing to the office. But this was a very temporary phase. बहुत jaldi people started realizing, Arey, if I don't eat, if I don't work, what am I going to eat? If I don't get to meet my friends, if I don't get to go on a holiday, what's going to happen to me? I can't be, it will be like as if I'm under house arrest. So there was a need to balance the economy as well as take as effective measures as possible to prevent the spread. So very gradually we had to open up the essential services first, services like the hospital OPDs, services like vaccination services, services like public utility services, services which are needed for a normal civic life, taking as many precautions as we could. And how ready were we? We also needed the initial phase of the lockdown to prepare ourselves. This was a new germ. This was something about which we knew nothing. Where did it come from? How to treat it? Should it get serious? How to prevent deaths? There was a phase where, if it got very, very bad, we were almost resigned to the fate that we're going to lose this person. The population density. So whatever you plan for India, especially if you would look at one of the effective measures, तो 2 गज की दूरी की बात की है हमारे seniors ने, वहां पर भी we have to wonder, we have to realize that if you are going to open up a public transport service, you open up a bus, you open up an office, you open up a bank, where are you going to be maintaining your social distance? There will be situations where it would be impossible to maintain a social distance. So the civic responsibility to the most effective vaccine, that is wearing of masks, becomes even more mandatory. In fact, as has been widely publicized by every possible healthcare agency, we do not have a known medicine. We do not have a known vaccine till now, but we have the masks. So please, please get it absolutely ingrained into every cell of your being that the best chance you give yourself of protecting yourself as well as of the people around you is to have a tight-fitting mask. Next slide, please. The next question which we would be looking forward to is vaccine. When is it coming? I mean, there seems to be an almost, an unhealthy political, urge to be a front runner and to come to the forefront and say, yes, we have a vaccine. So this has to be, please try and understand, has to be backed by solid, effective research. You cannot come to a situation where you launch a vaccine with a doubtful efficacy and then and to talk in simple layman's terms, I take a vaccine today and tomorrow I contract the illness. Who is going to be accountable for that? So introduction of the vaccine is a scientific process. There can be no hop, step, and jump here. Yes, our understanding of the SARS-CoV virus will probably shorten the time before we will be able to effectively launch an effective vaccine. But that doesn't mean that we get into a political rush to gain brownie points and start launching a vaccine. When is it coming? The simple answer to that is as soon as it is tested to be effective in human beings and human trials, give us an answer that it is effective. If you're going to be asking me a time frame, it could be sometime in the first quarter of next year. But if the authorities have to be careful in launching the vaccine, authorities means whether it is WHO giving a license, whether it is FDA giving a license, or the government of India giving a license, it could be anywhere between the first quarter to the second quarter of 2021. Once it is licensed, should we be taking it? The unequivocal answer is yes, you should be taking it. How effective will it be? Well, let me just go back a little bit in history. No vaccine that was launched on the very first day became 100% effective on the very first day. Look at the last pandemic. The last pandemic was the flu pandemic. When did it happen? About 100 years back. And the effective flu vaccine against the swine flu is now available. The flu vaccine went from 30% to 40% efficacy to, as of today, a more than 90% efficacy. So effectiveness is a process of evolution. Science cannot guarantee you 100% effective vaccine straight away. But yes, it will be a step in the right direction. Depending on the human responses, the vaccine will obviously improve with the passage of time. Next, please. Treatment-wise. So when we are looking at the future, do we know the disease better today? Yes. Initially, it was thought of as a purely respiratory problem, affecting only the lungs, causing respiratory failure, causing the lungs to ineffectually use the oxygen. Now we understand that it is not just the lungs. It can affect practically any organ in the body. The basic pathology is that there is an inflammation in the blood supply to any critical organism, to any critical organ of the human body. Are better treatment options available? The answer is, as our understanding of the illness has improved, we have been able to save more critical patients. Hence, the survival rates have improved. Dr. Poonam had listed the global mortality rates, the global recovery rates. Mind you, a large chunk of that statistical score came from the months of January to June. If you were to break up the global statistics from January to June and June to December, you would find a definite improvement. So that brings us to my last question. Are less people dying? Yes, less people are dying. So that is the optimistic note, that give doctors, give scientists a fair chance to understand the illness. We have already taken giant steps, I would venture to say giant steps in understanding the illness. Historically, people took more than half a century to understand a bacterial illness called tuberculosis. People took ages to even understand tetanus. And here in less than a year's time, we are beginning to understand the COVID virus. So I am very, very hopeful that with the challenge that we are facing, What we've been able to do this year, we will do much better next year. Next slide, please. So when can we expect to see the end? Is there any hope at the end of the tunnel? Soon enough. The questions to be answered are, will the virus lose its virulence? Yes. As the human body mounts a response, as the human beings learn how to detect the entry of the germ and mount an antibody response, it will lose its virulence. As more and more people get infected, and once the vaccine is introduced and it can increase antibody levels in the community, the herd immunity, that is, a large majority of the population, more than 70 to 80% of the population developing antibodies, that process gets expedited with the vaccine. And that is why we look forward to it. Can a specific antiviral be developed? Antivirals have been developed against the swine flu. Antivirals have been developed against chickenpox. Antivirals have been developed against other viruses like herpes simplex and even the AIDS virus. So there is no reason for us to believe that antivirals may not come against this particular virus. But again, the question is, how much time are we willing to give them? Until that time, are we willing to take the precautions of keeping ourselves masked, of maintaining our social distancing, and of maintaining our hygiene measures? Next slide, please. So what are the impact on academics? Like you are an engineering college. You're missing college, aren't you? You're missing your friends, you're missing your canteen, you're missing your social activities. So my dear friends, please remember the pandemic isn't forever. We are gradually going to overcome this. There is more emphasis as of now on e-learning, and that is the necessity of the situation. The necessity is the mother of all inventions. Things which we never thought we could do through e-learning, we are doing it today. So it's a bonus. We've learned that. Yes, I do agree that practical and vocational skills, that training has been effective. You engineering students, I'm sure you're going through your semesters now, but there are practical aspects of your training which has to be on the campus. And I do know that colleges are waiting to be reopened so as to teach and assess you regarding this. So that is a small price you're paying. So that is not something which should deter you. Human interaction has suffered. One of the very lovely questions I think so I got in here is that my friends in the engineering colleges were wondering as to whether elections can be conducted. My goodness, my friends, the Bihar elections have been conducted in India. We've had e-voting, mechanisms all along. So if you people have got a robust e-voting structure in place, please go ahead. It's going to be fun. Nobody is going to be, be spared the voting chances. Everyone can be tapped on their phones and said, hello, friend, please, you're not doing anything now. Go ahead and vote for the university elections or the students' elections. And you are going to have a good amount of fun for that. So, yes, human interaction physically has suffered. But yes, you can do a lot of it online, including elections. What will come out of this? Like any human challenge, we are going to be better off after this. There would be a beautiful balance, I think, between an off-site and an on-site curriculum. Maybe you are looking at a future where a lot of your studies are going to be conducted at home, and you would be doing a lot of your practicals in the college. And yes, to make sure that you remain social animals, so that you interact socially, you would have your social events physically, but there would be a balance. Next slide, please. Right. So whether you are a doctor, whether you are an engineer, whether you are a lawyer, whether you are a politician, whatever you are, what is going to be the impact on human nature? Would we change? Have we changed? I think so. The answer is yes. Suddenly our priorities have changed. We have realized that what is basic to survival is what we need to pay attention to. Things which had become a necessity, the realization has dawned on you and me that this is something which is probably a luxury and on which we can afford to spend a little less. Will our philosophies change? Yes. We are today encountering a situation like has been enumerated, that people are feeling helpless, people are feeling isolated, they are stressed, they're anxious, they're depressed. We don't need to be doctors to help out people in these situations. We can be step one. We can be a volunteer organization who has no training in medicine, and yet we can be of help to my neighbor to procure medicine supplies should he or she be affected. We can be of help to a friend who needs admission to a hospital, and we can be of help to society as a whole and help people overcome this pandemic. In all, it is a pandemic which is taking a toll on us mentally and physically, but it's also a challenge which will make us better human beings. Next slide, please. So I would say there was never a night or a problem which couldn't defeat sunrise or hope. I am the eternal optimist. Next slide. I'm sure with all our efforts, whichever part of society you may be belonging to, we shall overcome. Thank you.
So thank you, Shomik. That was brilliant. Shruti, can we take up some question and answers, please?
We would be glad to present some questions, Doctor. We have collected and our students have sent in a few questions. Let me just put those questions for you. One is in the chat box right away, which says, how to know if we have already affected from COVID-19 and recovered? Is the first question.
So Poonam, will you take that?
This can be, we can get the person tested by knowing his antibodies level. That is how we can get it done, through lab testing.
Right. Okay. And the next question is, does COVID-19 affect the heart?
Okay.
Yeah, I think so. We've just mentioned, that the basic portal of entry, whatever it is, through any opening, whether it's through the nose or through the mouth, okay, ultimately the virus is there in the bloodstream, right? And because it is there in the bloodstream, and the bloodstream, while it moves around in the human body, it can affect any organ. It can affect the brain, it can affect the heart, it can affect the kidneys, it can affect any conceivable human organ that you can think about. But yes, the first point of stoppage, train jab chalti hai, the first stoppage is the lungs. So that is where the maximum amount of affection takes place, but that doesn't rule out any other organ getting affected, including the heart.
So, Shomik, can I add to that?
Yeah, please.
So now, whoever has asked that seems to be very educated. Kudos for asking that kind of a question. So as Dr. Shomik has said, it may be the virus per se, but you see what happens is that other than the virus, your own body at times can take up cuddles around against you yourself. We have a very strong immune system. But when that immune system does not understand where to stop, it actually harms you more than it does otherwise. So, your own immune system's reaction can be such that you can have certain problems in your heart, certain problems in your kidneys. So these vital organs and your brain, so they may become a point of attack of your own immune system. So the virus per se plus your immune system, the interplay of these two is very, very difficult even for us doctors to understand and perceive at times. So there is an interplay and there is a problem which we are actually facing over here.
Yeah, it's like protesters, when they are protesting something very justifiable, and then suddenly they become very
Violent.
Lawless.
Lent.
Let's say lawless, right? Okay. Okay.
Thank you for that answer, doctors. That answers our next question as well, which was why does COVID-19 cause shortness of breath and loss of smell? So I think you've covered the same thing in the previous answer. So thank you so much for that. Okay, so there is one more question, which is when people are asymptomatic, can they spread the virus too?
Poonam?
Definitely. Yes, I have already said that the incubation period or the onset of symptoms can be in between 2 to 14 days. So on fourth day or fifth day, the person is having a disease, but he is not showing the symptoms. So that is the asymptomatic phase, and he can transmit the disease. That is why it is repeatedly being stressed upon to use mask.
Children are very big spreaders. They
Definitely.
don't show symptoms, but they keep on spreading.
That is why they
So,
are called super spreaders. Children
yes.
are super spreaders.
Right. Okay. So there's two more questions, which is what is the FDA's role in approving vaccines and what is being done to produce the COVID-19 vaccine? I think Dr.
Dr.
Shomik,
Shomik,
you already
yes.
mentioned a bit about that. Yeah. Doctor, you muted.
You're
Dr.
muted.
Shomik.
Shamik, you're
Sorry, I'm
muted.
really sorry for that. Yes, so let me just give you a time frame. End December, the first cases, atypical pneumonia cases, were reported. Mid-January, the offending agent was identified and given a name by WHO. As early as February, the genomes, that is the genetic makeup of this particular virus, was clearly identified, and if the efforts at developing a vaccine started off straight away in February. So I think so we need to give kudos to the world fraternity for taking cognition of the problem fairly early. But what everyone has to understand is there are steps in the development of the vaccine. We have to first identify which component of the virus is going to be the vulnerable component against which the vaccine is going to be working. Is it going to be the capsule? Is it going to be the nucleus? Because you're a science students, I'm taking the liberty of using these terms. But at the end of the day, we have to come to a conclusion after possibly a few months of research as to which part of the germ will be the most vulnerable and against which the vaccine can be developed. The next step that comes in is testing it on some lab models, which could be animals, who have a similar propensity to be infected as humans. It just cannot be any animals. It has to be animals who have a similar structure as human beings and who would exhibit symptoms similar to human beings. That would be the next step. And the third and the most important, you must have read about this in the newspapers, phase 3 trials. So phase 3 trials are on human volunteers. Now, friends, you would have to understand that here is something which is not being tested. Today, if I am going to volunteer, I put up my hand and I say that, no, I am going to be one of the volunteers. Some people might say that we are guinea pigs. Yes, I am going to be the human guinea pig. I put up my hand and I have to give a consent that, yes, this thing is being experimentally injected into my body, and I am prepared to go along with the fact that it may not give me any results whatsoever. There could be side effects of it. There could also sometimes, in the very rare case, be a life-threatening reaction to it. So once I have gone through these steps and I have enlisted enough number of volunteers, and mind you, it is easier said than done. Most people would be scared. Most people would say that, no, I'm not going to be taking this because this is not time tested. So here we are shouting for a vaccine, but we have also got to see the human nature, that how many are willing to put themselves in the line of fire and offer themselves for human trials. The final point which everyone has to understand is, even if a human being is injected There are no side effects. The person takes it beautifully, is having a normal life. The question to be answered is, how long does it take to produce the first antibodies? And for how long will these antibodies persist in my blood so that I can have a reasonable degree of protection? Today, we know that many vaccines require boosters. We need to be supplementing, topping them up at times to make sure that we are well protected. So, one of the vaccines which has got the shortest period of protection is the swine flu vaccine. It is just a year, and that is the one which is licensed with the shortest duration of protection. So, if we are going to be having a proper license, we are going to at least need a year to show that yes, so and so vaccine after being injected caused no serious side effects and produced antibodies which were persistent for at least a year. So this is where we stand today. So the timeline is research has started in February. This is December. We might be on the threshold of its launch, like I said, in the first quarter of 2021. But friends, be prepared that you may not get your definitive answer as to whether the launched vaccine is also effective till March 2022. That is the earliest that I'm looking forward to as to provide a clear answer as to whether we have an effective vaccine.
Thank you so much, Doctor. I think that was a very detailed explanation on vaccine that you just gave, and I'm sure this has clarified many answers. So there is one common question that is there in everybody's mind, and that question Ruma Gulati has also put up on the chat box. So she is asking, plenty of patients need a negative report after COVID to present to their employers or, when they start working. So what is that validity period of the reports that they have?
Shamik, will you take that up?
Yeah, surely. See, very honestly, I think so. We face the situation, especially a lot of government organizations, a lot of non-government organizations, they have been demanding this report. But let me today unequivocally state it on this platform that a negative report is not needed for you to rejoin work.
Yes.
That is the first and foremost thing which everyone should know. The test that is done to detect a virus can also detect dead viruses in my nasopharynx. Okay, that is my airway, right? So I become non-infective about 14 days after the virus has entered my system, like what Dr. Poonam had clearly depicted in her slides. So exposure, 14th day, I am well clinically. That is the time when I become completely non-infective and I am free to go out and mix in the community, right? So this requirement of a negative report is illegal. It has been clarified by the Indian Council of Medical Research. It has been clarified by the Ministry of Health. You can go to their websites and get it from there. All the state governments have fallen in line and they have given this very clearly, because till about 46 days or probably a while longer than that, the dead viruses can still be present in the airway and they might give you a COVID positive report. All right. So there is no value to a negative report. If you become negative at the end of 14 days, well and good. But if you are positive, say, 20 days or 30 days down the line, there is no reason to believe that you're going to be infecting others.
Thank you so much, Doctor. I think with this, we have come to the end of the session. And before I close or give my end note, I request Dr. Piali, what is your take-home message for all the students and lecturers who are here?
So my take-home message is what the government is saying, what Poonam has said, what Shamik has said: be intelligent, Do gaz ki duri, mask hai zaruri. So we are not unmasking very soon. Make nice ones. You can buy from Marks and Spencers and Shoppers Stop and things of that kind, or make your own. If you are creative, make beautiful ones with Disney Worlds and things of that kind. Welcome to the masked faces. So the masked man is a very welcome man these days. Will be till maybe middle of next year or so. So make it a habit, be masked.
Thank you so much, Doctor. That was a wonderful message, and everybody must remember to wear masks. It is going to stay with us for quite some time now. So, thank you so much for that information. And I think we've almost this session has been a complete briefing of all the 50 sessions that we have done previously. So, we have covered what is the general COVID situation that we have and what we had in the past 8 months. What is the path forward? Right, and what we have spoken about vaccines, we have spoken about what WHO is saying. So this is a kind of complete briefing of all the 50 sessions that we have done so far. So thank you so much for that. I now request Dr. Vandana S. Bhatt from SDM MET to please say a few words to our doctors here. Dr. Vandana, you're muted.
Yes, yeah. Good evening to one and all. I would like to thank all the speakers for today's session, Dr. Piyali Bhattacharya, Dr. Poonam Bhatia, and Dr. Shamik Ghosh for their wonderful session, and having spent their valuable time in sharing their thoughts on the topic COVID-19, what do we do till now and way ahead. I think the entire session was very informative to both the faculty and students. And I'm sure we are all in anxiety that this would get into oblivion soon. I would also like to thank the organizers for having organized the webinar. Shruti and Vijaya ma'am, a special thank to you and hats off for the successful webinar on COVID-19. Thank you one and all. I also like to thank all the participants who have who have coordinated themselves to spend their valuable time in attending this webinar in spite of their other schedules of their academic activities. And lastly, I would like to thank my department head of the department, Dr. Jagdish Pujari sir, for having given us the permission to organize, and our principal also. And finally, last word to my coordinators and my fellow colleagues. Thank you.
Thank you so much, Dr. Vandana. To end the session, I would like to thank each one of you for always being here and for participating in all these webinars and getting more information and staying updated about what COVID is all about. Thank you, doctors, for taking time off a busy schedule and coming here and doing this wonderful session for us, I think, which was very much needed for the students as well as the faculty, as Dr. Vandana mentioned. And my special mention to SDM College, Department of Information Science and Engineering, for organizing this along with Project Step 1 and taking interest in updating and asking the students to actually stay updated about the situation right away. So thank you so much, and you know the drill, so please go like our Facebook, Twitter, LinkedIn, and pages to go forward to have more information on Project Step 1, and visit www.projectstep1.org for more information about Project Step 1. So thank you so much for being here and for attending this wonderful session. Thank you.
Thank you, Shruti. Thank you, everyone.
Thank you to one and all. Thank you so much.
So